and it's going to be on the YouTube channel. But if you'd like to record it, tweet it, etc., all members are allowed to do that. And if you find that you want to speak but you don't want your face to be seen, you can switch your camera on, but just keep your audio. Okay. I'm just trying to think. Is there anything else? Any other things I need to say, Julie? I'm just thinking off the top of my head, my briefing. I think that's it at the time being. We've got a number of guests for the meeting, and I'll introduce you one at a time. So hopefully give everybody a chance to speak. And then if you want to put your hand up either in the chat function or in the physical reaction function, and then I'll include you into the conversation. Okay. Can I just check there's any apologies for any lateness or absence from everybody? Julie or Fitzroy, we had any apologies?
No, we haven't received any apologies, Chair. Okay,
so hopefully Councillor Rule will join us later. Okay, and item number 2, there's any notification of any urgent business?
There isn't.
No, I haven't had any notifications any last minute. Item number 3, disclosure of urgent business or disclosure of interest and dispensations. Does anybody at this moment want to declare any interest or dispensation in any of the subjects we're discussing? Anybody linked to the NHS?
No, Chair.
No, Chair.
No, Chair.
Well, my daughter works for the London Ambulance Service.
Okay, thank you, Councillor Lambe.
Chair, my partner is a director at Great Ormond Street Children's Hospital.
Okay, thank you for telling me that, Councillor Williams. Anybody else who's got any links with NHS, because we will be talking about mergers between Guy's St Thomas and Harefield, etc. Okay, all right. If we go on to, I'm just checking if there's minutes from the last meeting. I don't think we've got any minutes from the last meeting.
No, Chair, there isn't, because they're in the previous administrative year. So
previous minutes. Okay, right. Thank you, Julie. Okay, so if we go to item number 4, update on care homes and impact of COVID-19. I think we've got 2 approaches, one from the response from the council and local partners to the pandemic. Unfortunately, now we're in second wave. Have we got any speakers for this, Julie? Sorry, because I haven't got anything up at all.
Yes, we do. We have a few. We've got
we're going to start with Jeanette Laws.
We've got Jeanette Laws and Sam Heppel-White. And then after that, we have Christian San Pedro, the area director for the haircare provider HC1.
Okay.
Then we've got Ross Diamond, CEO of Lewisham and Southwark Age UK.
Okay. Okay. Can we just start? Can I just check with all members and everybody that's got a copy of the reports, because there's a lot of agenda and report documents attached to the agenda. Has everybody got them? Because I don't want to be referring to reports that you haven't seen. Okay. So can we have the first speaker then? Is it Jeanette Laws? Is she there? I can't see her on my screen. Jeanette. Hi, Jeanette. How are you? Go ahead.
Jeanette, you're on mute.
Jeanette, you're on mute. That's it. Okay. Go ahead.
Okay. Sorry, it wouldn't respond when I was clicking on it. Okay. So I'm presenting this with Sam Heppel-White, who's the MD for the Borough of Southwark in the South East London CCG. We provided you with a series of slides, which is an update since we last came to speak to you about care homes. I'll do a short introduction. I'll hope that colleagues may want to spend more time speaking about the contents and the other speakers that have been invited. So since we last met, which was some time ago, I think it was in September, there has now been a recovery plan that's been published through Partnership Southwark. And Partnership Southwark, as you'll all know, is a multi-agency partnership across health and care and the voluntary sector. So Community Southwark are now a partner within Partnership Southwark. The recovery plan has 4 cells, and the 4th cell is around Carewell. Carewell being focused on the care settings that we have in the borough. So it obviously focuses on care homes and nursing homes, which you're interested in today, but also looks at other 24-hour accommodation settings like extra care and supported living. In terms of the slides that you've got in front of you, it talks about the response that we made, reconfirms the information we shared with you before, and gives a bit more detail about the collaboration between the statutory agencies and the care homes themselves. Talks about how we shared intelligence and also worked together across some emerging issues. And as you know, all agencies had a lot to learn at the beginning of the pandemic in relation to the PPE guidance, in terms of infection control and so on. In terms of the key planks to managing the risks, the slide set out the 5 key areas really that we were all working on together. So that was around PPE, ensuring there was sufficient PPE for all of the workforce. In terms of infection prevention and control, which at the beginning was about additional training for care homes, but also looking at the money that was provided by government and ensuring that we were funneling that through to the agencies that qualified for that funding. We also worked on testing. So right at the beginning, you'll recall that there wasn't a government programme for testing residents and the workforce. So we worked very closely with the CCG to ensure that they could access testing. We now have for care homes routine testing, which relates to the workforce being tested every week and residents being tested every 28 days. We also had to work through issues around admissions, which we talk about in the slides. And we also looked at how we managed contact being mainly around visits from loved ones to see their residents. So you asked us to talk about visiting in particular. It was something that you were interested in when we last presented on care homes. And you'll recall that initially during the pandemic, visiting was very limited for family members, and in fact tended to be on compassionate grounds, usually around end of life. So we very much relied on the digital offer, using the things that we're using today, like Zoom and so on, but also telephone, the old-fashioned telephone as well. But that was never really going to be sufficient. And as soon as the restrictions were lifted by the government from July onwards, care homes were looking at opportunities and ways for physical visits to resume in really safe circumstances. And in the slides that you have in front of you and in this pack, I think it's on page 17, you can see a variety of arrangements that care homes made in terms of family members being able to resume seeing their loved ones who are in care homes. At the same time, our public health colleagues published a framework which was really clear about how we managed visits to care homes, initially in the context of potential outbreaks in care homes that would be identified. But then latterly, it also was updated to reflect the tier system that the government introduced prior to this lockdown. And as you know, prior to this lockdown, we were in tier 2 as London, and that meant that visits were pretty much reverting back to the way they were at the height of the pandemic, i.e. limited to compassionate visits, end of life, the default being digital contact. So hopefully the slides have been a helpful setting out of what's been happening since we last met, and also a reminder of what we did from March onwards. And I don't know whether you, Sam, has anything to add to the introduction of the slides. I didn't want to go through them line by line. I think you really want to talk to the guests, like the care home managers from HC1 and so on.
Okay, can I just check? Thank you, Jeanette, for that. And it's really good because I quickly skimmed. I've read it a couple of times this evening, and it's really good, the recovery plan and whatever. And it's ironic that the last time we talked, we were saying that we planned for second wave, and unfortunately we're in the second wave now, isn't it? It seems like the second wave is following our meetings. I mean, Sam, did you want to add anything to what Jeanette was saying? before?
No, I think Jeanette's done a fantastic job of summarising it. So I'm happy to answer any questions as we go through.
Okay. Just before we do that, now I've got my other laptop up and running. If I just want to do the formal sort of introductions and whatever. I was going to check just in case, because sometimes when using Zoom and online, sometimes the internet connection can go. But if anyone has a loss of internet connection or power, please inform Fitzroy Williams or Julie Trimble. I think you've got their email, and they'll via email, and they'll send you the Zoom details again. So then what we can do is adjourn the meeting, and then hopefully you're restored. What I forgot to say, that in this meeting, normally it should take up to 3 hours. I try not to let it get past 9 o'clock. So what I'll try and do every hour, take at least a 5-10 minute comfort break, because I know that sometimes online meetings can be just as intensive as face-to-face. So at least I'll take a next break about 7:30 something to 8 for 10 minutes. And I'll try and do that every hour, so at least everybody's comfortable. Okay. And last but not least, in the interest of health and safety, as I said, I'll take the 5-10 minute break. But just before we go ahead, if I just check that all the voting members are here, because obviously if the general public are watching, they won't know who they are. So can I just check, if you just introduce yourself when I call your name. Councillor David Noakes, you here? Can't hear you. You're muted.
Sorry. Should have learned by that by now. Sorry, I'm Councillor David Noakes. I'm the Vice Chair of the Health and Adult Social Care Scrutiny Commission, and I'm a ward councillor for Borough and Bankside Ward.
Thank you. Councillor Sonny Lamb, can you introduce yourself, please?
Yeah, Councillor Sonny Lamb here, community champion for North East Multi-Ward and councillor for South Bermondsey. Nice to be here.
Thank you. Councillor Maria Linford Hall, please introduce yourself quickly.
Thank you, Chair. I am Councillor Maria Linford Hall, councillor for St George's Ward, and a spokesperson for the opposition for adult social care.
Thank you, Maria.
Thank you.
Councillor Sandra Rule's not here. Councillor Charlie Smith, if you want to quickly introduce yourself, please.
Yeah, thank you, Chair. Yeah, Councillor Charlie Smith, a member of this scrutiny committee. Thank you.
Thank you. And what ward do you use, Charlie?
Hold on. Goose Green Ward.
Thank you.
Yeah, in sunny, leafy East Dulwich.
And last but not least, Councillor Bill Williams. Do you want to introduce yourself, please?
Thank you, Chair. Councillor Bill Williams, member of the committee for Rotherhithe.
Thank you. Okay, I just wanted to do that. Okay, if we go down, let me check and see. At this point, can I just ask members if you've got any questions for Jeanette at this point about the recovery plan, because there's a lot in there compared to what we had before. Okay, take it in turn. Councillor Bill Williams. Anybody else? Yeah, go ahead.
Thank you, Chair. I noticed, let me go back to it. On page 18, you were talking about, because we're back in tier 2, so it reverts back to lockdown conditions. I want to know, can you explain a bit about the compassionate visits, what that means and when they happen and how they happen, as opposed to the first lockdown, and what lessons have been learned for that?
So we very much rely on the care home knowing the families and the circumstances, and certainly even during the first lockdown, I was made aware of visits that occurred where, for example, a relative really just couldn't get to grips with using the digital platforms, and therefore they did support visits in terms of PPE being provided so that those visits could take place on a less frequent basis, but nonetheless took place. We equally had examples where if, for example, a resident had a fall and it was felt that it was better to have a physical visit than rely on the digital platform, again, it would take place. So it's very much something that the family members and the care homes work through together, and certainly we didn't have issues raised with us, and we were very much in contact with some family members. That was not something that was raised, the issue around visiting with us.
So if somebody is on the end of life,
Yes.
will a physical visit be allowed
Absolutely.
Okay.
That's always the example that's given, but there are others that are less
Sure.
less extreme that I think is important to share as well. People really do try to accommodate the needs of the residents.
Brilliant. Thank you. Thank you very much. Thank you, Chair.
Thank you. Is there any other questions? Councillor David Noakes, go ahead.
Chair, and thank you for the report, Jeanette. I just wondered if you could you just give us an update in regards to what the position has been in regards to any further deaths in the care homes? I think in the summer months, I think I'm going back to July, there had been 60 deaths, I think, across 4 of the 8 homes. My memory serves me right. I mean, have there been further deaths? Do you have any up-to-date figures that you can provide us?
So we have had further deaths. I don't know the numbers in terms of COVID-related further deaths, which I think is important to distinguish from, the usual passing of residents. But I can get that number back to Julie to circulate to the committee.
Okay, thank you. Have you got follow-up questions? I'm looking at you, David. Did you want a follow-up question?
I'm just wondering. So I think, as I say earlier on, I think the COVID-related deaths in the first wave we're amongst 4 homes, I think.
Yeah.
Do you know? I mean, maybe again you'll have to come back to you on this. But do you know if that's continued to be the case, or do you know if there's been further deaths in other homes, COVID-related, in the other homes or not?
So I wouldn't want to say without looking at the figures, but we haven't seen significant numbers that make us concerned, because I think once we got a grip in terms of the PPE, the testing and so on, I think it would be what we would expect. We have had the occasional outbreak in homes where we have identified that people have been positive. And sometimes, interestingly, those outbreaks can be just of a resident. So we describe an outbreak as any positive case. So it sounds worse than it really is. And in those circumstances, sometimes it's an outbreak is related to a single resident and no staff members. So we're still really learning around this particular virus. But we'll get you the numbers and we'll look at whether there's any additional homes. But I don't believe there are. But I'd rather give you the specific, a detailed answer, a correct answer.
Okay, thank you.
I'm sorry, I wonder if I can come in, Chair, just very briefly. It's Jen from Public Health.
Jen?
Yes.
Right.
I'm not sure whether Zoom has a little hand. I don't think.
Yeah, you can put it on the chat function.
Okay.
You've got
Apologies. But just to pick up on the point about the care homes and cases, the cases that we are seeing, they tend to be asymptomatic, and they are picked up through what we call the cold home swabbing. So I think Jeanette referred earlier on that it's far more systematic now, access to testing, the sort of weekly and monthly testing. And when we do the testing of people, the cold home swabbing, where we think there are no cases, we're picking up the cases because they're sort of asymptomatic cases.
Okay, thank you for that, Jane. Any other questions for any members? Sorry,
can I just ask something?
See if I can take Charlie and then Sonny and then Bill. Go on, Charlie.
I know it's very, very early days following yesterday's announcement about the possible vaccinations, but I wonder if we are looking to put things into place. I mean, as we know with the test and trace, once the councils, the local authorities took that over, it became far, far quicker and reliant. And I just wonder whether there's room for local authorities to take a share in the vaccinations, liaising with GPs, etc., setting up places, clinics where people can go, or GPs can come and visit people at home to carry out the vaccinations. Because it's been suggested that it will be people in care homes and NHS staff who will probably be the first to receive this new vaccination. And I think that's quite pertinent compared to what we're talking about.
That's a good question, Charlie, because it seems that the government are trying to action that as soon as possible before Christmas, isn't it? So I think as local authorities, we have to be on the front foot. I mean, do you want to, are you able to answer that, Jeanette or Jane?
Would you like me to, shall I start there? It's Sam from the CCG. I can start. And then, hi. So you're right, Councillor Smith, we haven't got all of the details yet, but what we do know is that general practice will be commissioned to provide the COVID vaccination service to at-risk patients and care home residents. There's already been quite a lot of work between the NHS and the local authority, including Southwark Council, to identify some mass vaccination sites so that residents can access those, but also to work with general practices and groups of general practice to identify sites where they can provide services as well, because residents will be given a choice of where they want to go, whether they want to go to one of the max vaccination sites or one of the local sites that are going to be run by general practice. But I think there's a huge amount of work that we can do together on this, because we need to get out to as many residents as possible, and we do appreciate that there are going to be different sites that are attractive to different cohorts of people. So just to reassure you, we have already started working together, and we will continue to do that.
Okay,
thank
and
you.
can I
Thank
just
you, Sam. Thank you.
Thank you, Sam. And can you keep the Commission updated on that, please, Sam? Because obviously everything seems to be changing from meeting to meeting, isn't it?
So
thank you for that.
What we can do is just send you through a very a simple guide to what we know so far, and then we can keep updating you.
Thank you. Thanks, Lam. Next one, Councillor Lamb, you had your hand up.
Yeah, thanks, Chair. I'm just trying to follow up on the supply of PPE and how sufficiently equipped the care homes. I know at the beginning we had a problem. Is that resolved now, or are we still having some problem? And how does that affect the staff?
So the PPE is resolved in that most providers now have a stable supply of PPE, and in addition to the supply that they have independent of any agencies, they also have access to a portal to receive a sort of top up of PPE that's COVID related. So it'll be about face masks and aprons and so on. And that portal seems to be working. So the feedback we're getting from the forums is that the portal overall is reliable and providing a stable backstop for the providers. And probably helpful to say in addition that as a council, we've decided to keep our own mutual aid stock anyway. And if providers really do get stuck because their independent supplier has let them down and the portal isn't available, we're available to help them with the PPE. So we're taking it very seriously to keep the workforce and the residents safe.
Thank you, Jeanette. Next question is from Councillor Bill Williams, and I'll come to you, Maria. I've seen your hand up. Thank you.
All right, Chair, I don't have a question. Thank you.
All right, okay. Comments, okay. On to you, Councillor Maria Lingford Hall.
Thank you, Chair. It's just one question again about the residents on care homes that are treated inside of the care home. What is the percentage compared to the ones treated at home, in the home, or treated in hospital? And what is the percentage of surviving of the people treated in hospital?
Is that a question about treatment in relation to COVID-19 specifically?
Correct, yes.
Okay, I don't know those numbers, and I'm not sure that Jin necessarily would, but we could go away and get those numbers in terms of what they look like. I'm afraid I don't know those numbers.
Thank you. I will be interested to find out how many people are actually treated at home and survive, or how many people are moved into a hospital and also survive, and compared to dying or surviving. It's just a matter of interest. Thank you.
Okay, thank you, Maria. If there's no other questions, can I ask, is Christian San Pedro on the line? Julie, from HC1 in Towbridge?
Hi, good evening.
Hello?
Hello.
Hi. Welcome to the, because I'm just seeing you on second screen. Hi, if you just want to just give you a verbal response, obviously to two themes. I mean, really, because we wanted to hear from, your response on the ground in terms of what you've been facing through COVID 1 and 2, but also at the same time to give us the impression of a provider within Southwark in terms of how you're supporting families through the first wave and obviously the second wave, and any insights. And so then we can ask you questions at the end. You've got 5-10 minutes. Is that all right, Christiane?
Okay, yeah, so I'm Kristen. I'm the home manager of Tower Bridge Care Center. I'm also the area director, area quality director of HC1. I've got 2 other homes aside from Tower Bridge that I'm looking after. So I've been asked to just provide a feedback about how SODOC can work together in treating COVID. Tower Bridge is one of the first homes, I think, that was hit by COVID. And I can say that it has been an amazing support from the local authority, the CCG, the GSTT, our consultant geriatrician, our GP practice. We were informed at 10 o'clock by St. Thomas Hospital on the Thursday night that I've got 1 resident that was admitted with positive swab. And on the following morning, I received calls from CCG and the local authority asking what support they can give. So they sent us our PPEs as we didn't have masks at the time because it's not a normal PPE in a care home. And from then on, there has been a daily support from the medical practitioners. The GP came in, the nurse practitioner came in, our consultant has been there. Our nurse our geriatrician also did a group in WhatsApp, which has members from other care homes, the multidisciplinary teams, the mental health team, and have never seen a team of people who's actually talking about issues and how we can resolve it and how we can support each other. So overall, my experience in SODOC with the support that we had in Tower Bridge has been great, and it has been amazing for our residents. I did not have an experience of when I need to transfer a resident to hospital, that London Ambulance Service would deny that opportunity to be transferred to hospital. Has been great. And in terms of keeping relatives informed, we have the technology such as your tablets, your smartphones. There has been a lot of calls. We have dedicated our wellbeing coordinators to make sure that calls are received, but as the same talking, we know that loneliness is something that our elderly has experienced on the first wave of COVID. And it has an impact on weight, on their eating and drinking habit. And it's just very sad. But also, we had the support from the mental health team, the CHIT team, in talking to our staff because they needed that support as well. So it's not only about the residents' behavior, but also the staff. So which has been really positive in my experience in the first wave. And this has been ongoing until now. And I can say that Tower Bridge has been very stable, and we have been able to look after residents with symptoms in the home.
Thank you. Can I take any questions from members now? Thank you, Christian, for that feedback. Any questions from members? Okay, first one from Councillor Maria Linford Hall, please.
Thank you very much for your presentation. I think that a lot of the charities are saying that visits to care homes are not really advisable because they are counterproductive in a way, because especially people with Alzheimer's, they get very confused and they just don't know what is going on. They don't know what is happening. And so they are saying that it will be better for them not to have visits from the relatives. What do you think about that?
I don't think that that's appropriate or correct, because even though a resident with dementia, he's already on that end stage dementia. It's not just about the memory; it's about the feeling as well. It's the same as, you know, you have something that is connecting. So family members who visit, even though the residents don't recognize them, there is that connection. And sometimes it's good for the resident. They respond more to relatives or family members that because of that memory that they had. And we always we always advocate for family members to visit because they know the residents better than us, and they can actually help and support us to give the care that they needed.
Yes, because they know each other, so the relatives can say this is the way that he will react better or she will react better. So it's an advice as well as the having being together, the patient and the relative.
It's a connection.
So because of the connection,
yes.
The feeling of connection.
Well, for me as well, with this statement that you've said earlier from like the volunteer groups, it's like we are making a bad statement about residents who's in a care home, that once you're in a care home, you're there. There's no other life. You cannot visit because your relatives doesn't know you, and it's not right.
It's just that the charities are saying that they want to stop that because they think it's counterproductive. So I just wanted to see your point of view, and thank you for your answer. Thank you. Thank you, Chair.
You're welcome. Has anybody else got questions? Councillor Noakes, go ahead.
Chair, and thank you for your presentation. I've got two questions actually. One is in relation to if you do have an outbreak of COVID-19 in the care home at Tower Bridge or one of your other homes, what is your procedure to contain that resident in their home, would they automatically go to hospital, or what's the sort of procedure to deal with somebody when you do have an outbreak? And secondly, I just wondered if you could tell us about how the staff are managing with the second wave and obviously having to deal with all that they had to deal with over the last 6 months, and have you had issues with staff numbers, etc., and staff getting COVID-19 and having to self-isolate, etc.?
Okay, so with residents with symptoms or has been tested positive, because it depends. Now that we are doing the testing every 28 days for the resident, we can definitely see whether a resident is positive or not. Unlike previously in the first wave, we don't have a test basically, and we just treat every resident with cough or fever as suspected COVID. So when that happened, we, as I've said, we had a consultant geriatrician that came into the home, did the assessment for all of my residents, and we talked about ceiling of care, which means then that we were able to provide and ask for the help from GSTT in regards to if a resident needed to go to hospital, if we can treat it in the home with IV antibiotic or fluids, then we do it in the care home. If a resident has a greater rate or chance of survival, because remember they're elderly frail, the average age is 80 for my residents. So if they will be able to, then we do send them to hospital for further treatment. Now, I think it is working with the family members as well, with the multidisciplinary team who will be able to explain to them further about what will happen in the hospital, the chances of survival in the hospital, and also that we are able to look after, get a team of staff with the support of the professional that comes into the home that is able to provide that service. So we have the at-home team when we needed an IV antibiotic or fluids. So what is the difference of transferring an 80 years old resident to a hospital when we can actually bring the hospital into the home during that time? So that's how we manage in Tower Bridge. In terms of the staffing, we did have initially the staff were all scared because we don't know what's happening. However, with the right support, personally, I stayed in Tower Bridge 24 hours. The first week that I was there, because I want to support my staff in making sure that they feel that they're not on their own. There's limited information at the time, and now they have understood. They were very happy when we started the weekly testing. So before the government, because HC1 worked with the Department of Health, and we were part of the pilot for weekly testing of staff. So then when we first got that first test result that all the staff were negative, it was a relief for the staff, because they know that yes, they have been exposed in some parts, or some of them has been isolating, but now it's a reassurance that when they go home, they had the test result, it's negative, they're not going to bring it home to their loved ones. So they're able to cope with it more than before.
So just as a very quick follow-up, so you haven't had any real sort of issues with staff numbers? You've managed to maintain the levels of staff that you've needed?
Well, we did have initial issues with staffing, but we have a team of staff, like ancillary staff, housekeeping team. We have what we call in HC1. Before the lockdown, we have been receiving information already in terms of there could be a possible outbreak in a care home. So we are prepared. We already have the what we call critical staffing grid that we have planned. So we also offered staff for sliding shifts, redeploy some of the staff who's, say, for example, doing well-being or activities into helping with care, or the housekeeping team. I went to wash dishes, so because some of my kitchen staff went off sick. So that's the kind of thing that we as a team in Tower Bridge has done to make sure that we don't use agency, that we don't know where that agency person come from, that could bring more virus into the home. So we reduced the agency food flow. I did not use any agency in the home, which helped with my team.
Thank you for that, Christine, because I was just about to ask that question from what Councillor Noakes was saying about staff turnover, but also especially to put my trade union hat on, staff exhaustion as well, because there's one thing saying you're working 24 hours and whatever, but I'm concerned that if staff are moved from one task to another, you know, one, they need the training, but two, it's tiring. I mean, on the one hand, there could be a cleaner one day, the next day they're expected to do support work and whatever, and that's additional impact on them and their families as well. Yes, I know that you're doing regular testing, but that impact on that staff as well, emotionally and physically. Do you know what I mean? And the fact that, and I was going to ask, do you use any agency staff as well? Because there's not a problem using agency staff, but it's actually keeping your staff team tight, isn't it? But making sure that your permanent staff don't burn out. Because now we're in second wave. You can give people sliding shifts, but if they're not got time to recover, they'll be concerned there, won't they?
So when we had the first wave, it was contained into one unit only. So I cohorted my staff. So it was only one unit. And when I say about other staff redeployed, so say, for example, you're a housekeeper, instead of the care staff doing the beds or making the beds, the housekeeping team helps in making the beds. We prioritize what's important, essential. The staff are only working their hours because obviously I have to look after the well-being of my staff as well. They were already scared at the first day that they found out that we have an outbreak in the home. Most of my staff already phoned sick because they started isolating as well. As for the agency, as I've said, we have in one unit. The first outbreak in Tower Bridge happened in one unit only. And now, aside from that, we have what we call flex force in HC1. So they are not employed in a specific care home, but it's like our bank system. So we can pull them because it's cohorted as well. Majority of the flex force worker that is in this area works in Tower Bridge already. So they have been I've been utilizing flex force to work in my home as well. So it's reducing the use of agency, looking after the staff as well-being, and giving them enough rest, because I don't want them to be worried. But as I've said, in the first week, it was really difficult.
Okay, thank you. Is there any other questions? Jeanette, you've got your hand up. Did you want to ask a question?
It wasn't a question, it was just to follow up Kristen's point about use of agency, because The guidance is really clear to try and minimise staff moving between homes, which is why we've been working with care homes to reduce that, and that's what the government funding was also there to support, the infection control fund. And it's probably important to note that in the capacity tracker that we've been using to understand what the workforce looks like, as well as the activity of our residents, what we've seen is an increase in the number of employees in our health and care sector, because what we're seeing is that the homes and home care are increasing the number of people they have, so that they're not relying on agency. So Kristen's point about trying to reduce agency is something that is encouraged, and we're working together to ensure that where necessary and possible, we're recruiting additional people into permanent roles.
Thank you for that, Jeanette. There's no more questions. I was going to say, unfortunately, quickly, Councillor Lam, yeah?
Yeah, thank you, Chair. I was going to ask, I don't know, is it Christine, the lady? Yes. How do you keep the residents active, considering we now have a prolonged lockdown, and the the effect it may have on their mental state? Please.
We have our activities planned in Tower Bridge. We also have a garden in the home, so a breath of fresh air when the weather permits us to do so. We have our because activity is not just a activity coordinator's job, it is for my care team as well. So it's about playing the right music, doing specific one-to-ones with the resident when we are not in lockdown or when they're not in isolation. We do a small group now with socially distanced space as well. We have few different lounges in the home per unit, so then we can have individual like residents in their specific unit, not going up and down. We also have our, as I've said, contact with family is very important. We have tablets. We show them. We use it as well, not only to communicate with the relatives, but also as a reminiscing. Music therapy is very good, and that's how we keep our residents active. Also, it's about the relationship with the staff, and most of the majority of the resident, even with dementia, has a good relationship with our staff members, and they know how to communicate and how to make them happy. But obviously, sometimes they still look for their relatives, so that's when we call family members using our tablets and sometimes even if it's the staff own phone, because there's a lot of calls going on in the home.
Thank you. Thank you, Chair.
Thank you for that. Okay, if there's no more questions, thank you for coming along today, Christian, and giving your feedback from Tower Bridge, because I think it's good to hear from the care providers on the ground what's actually happening. Can I just say to you, unfortunately, we haven't got any representative from Anchor Hanover. Unfortunately, they couldn't attend tonight. So can I ask Ross Diamond from Southwark Age UK to give a quick feedback on keeping in touch with friends and family, what they've done, and also the update on the late inspection scheme, please? Thanks, Ross. Quick 5 minutes. Thank you.
Yeah. Thank you very much, Chair. Certainly this charity does feel that visits and engagement with family in the outside world is really important. Generally really impressed with both the councillor's questions and the answers from Kristen. I was struck by the presentation before, which talked about some of the virtual meetings with families and that they want more of those. So that's something that we'd be really keen to see. I don't know if it's clear that the residents are supported to use video conferencing and a range of and phone calls and so on. And just wondered if we're aware of any of the family members that need support with that, because there's lots of support we can provide. We've got some free devices donated by Hubbub, and we can find volunteers to help family members with use of the devices, so they feel confident with them. In terms of the skills, and the devices that we've been donated come with limited amounts of free data, because that's obviously an issue for people as well, not just having the device, but being able to afford to actually use it. So very keen to continue those conversations. In terms of the lay inspection service, so I spoke earlier this year, it was pre-pandemic, about the lay inspection service, which we were ready to relaunch at that point, but because of COVID, we put it on hold. We have now restarted that process, or we're just in the process of doing that. So we've just appointed a new member of staff to lead that service. So it's somebody that we know to a few of you, Andrew Loxton, who I think was a commissioner within Southwark for a while. So he's taking that role on with us, and we'll be starting in the next couple of weeks. So what we'll be doing is, in part, is working with the care homes and the borough to help assess the care homes against the new quality mark, to make sure that the life for the residents is as good as it possibly can be. So we're very excited about getting going with that. I guess the other comment generally is there are lots of other kind of online activities that some, tailored for people with dementia, without a whole range of things that we're offering and we're promoting. A lot of them are very local services, so people can see local faces and local places and so on. And it's worth looking through our My Social calendar. So My Social is, normally it's about activities that go on in the community, but a lot of it now is obviously online. But obviously when this phase of the lockdown ends, and should the vaccine be, as effective as it looks like it might be, and so on, we're really keen to kind of get going with actual events again, where we would, for example, I know one of my partners that we work with is Time and Talents. They do a kind of tri-short bicycle ride for care home residents, where they cycle them around safely and comfortably and get them outdoors. So there's a whole range of things the voluntary sector is kind of ready and waiting to do. In the meantime, a lot of it has to be online of necessity, but do let us know if people need help with accessing devices and learning how to use them. But yeah, I don't think there's too much more to say on that, other than, yeah, we're really looking forward to get the lay inspection service up and running, and we'll be engaging with the care homes, the residents and the family members, just to talk about their experiences during COVID and see if there's any ways we can make life better.
Okay, thanks for that feedback, Ross. It'd be good for you to maybe send us a briefing paper, because our next meeting will be early January. It'd be good to see how you've got through the sort of the winter, November, December, and what it looks like in January, because by then, hopefully, if the vaccine has worked, then in case of January, you might have a whole thrill of activities and saying, this is what we're actually doing. So it's not just social distancing and not just everything over the phone. It'd be good to even just send a briefing update paper to us early January to say, this is what's happened now. This is how we've got through November, December, really, because I think we're taking tentative steps. Is there any any questions from any members to Ros before I move on? Councillor Noakes, quickly. Thank you.
Yeah, thanks, Chair. Sorry, Ross, I didn't quite catch what's Andy's new title, and Andy Loxton?
Yeah, he'll be managing the lay inspection service.
I'll be managing it, right? Okay. And when is he started, or he's
starting? We haven't yet exactly got a start date, but at some point in the next 2 weeks.
Okay. Thank you.
Councillor Smith, thank you. Question?
I was going to suggest, often if people aren't computer literate, to be able to sort of tune into their granny or their mum, it's often the children of those people, the youngsters, 5, 6 or 7-year-olds who have a PlayStation, who probably know how to do it and can give good advice, actually.
Yeah,
I know my grandchildren help me out all the time.
Yeah, that's a good idea. And there's that intergenerational contact, if we can have that with the tier 2 lockdown. I mean, once that's relaxed, then the grandchildren can help older members. And also it'd be good, like what Rosie was saying about, if you've got those equipment available, there's an assumption that everybody's got that smartphone and tablets available. Be good to see how it's rolled out. Okay, can I just thank you for that? Can I move to Rebecca Swift from Enterlicky Arts, or is it Maddie? Maddie, are you doing that instead?
Hi, it's me.
Sorry,
it's me. Yes.
Oh,
yes,
hi, Rebecca. Hi, you're on the next screen.
Hi, everybody. And I think this may help to answer a little bit, a smidgen of Councillor Sunny Lamb's question about mental health as well. I have a PowerPoint. I don't know if I can share screen. And
you should be able to, Rebecca. Yes.
Great. So bear with me, because I've actually never done this before. So here
we go. It's working.
Oh,
there you go.
let me see if I can, oh, it's even gone big. That's amazing. So we have been, Intelligent Arts are very deeply rooted in Southwark. We've been actually linked with Rotherhithe Theatre Workshop back in the 70s. But since 2015, we've been in residence at Tower Bridge Care Home, collaborating with the wellbeing team there. Let me see if I can click. Our outcomes during COVID-19 was very simple: to keep connected and make sure residents felt loved and appreciated, and to continue to celebrate the residents' contribution back into the community. So this is about ensuring somehow during such troubled and challenging times that these walls don't become, you know, like an iron curtain that you can't get through, that there is some porousness in the walls between the outside world and the inside world, and that culture can move back and forth through different mediums. So yes, we have a long-term association, and the two wellbeing coordinators, who are absolutely fabulous, Paulette Dixon and Maria Johnson, have been our main point of contact, and it's because of them really that we've been able to work long-term at Tower Bridge Care Home. This is context. This is a production we did with Tower Bridge Care Home in Elephant Castle Shopping Mall in 2016. And we brought all different groups of the community together, and it's about residents being visible and contributing back, and how well-being emerges from a sense of giving back, whether you're in the palliative care ward part, you know, and you may be profoundly disabled, you're still giving back through your stories and the sharing of energy. Since lockdown, obviously we haven't been able to go in. So we've adapted and worked with sending in videos, exercise videos, poems, letters, sonic letters, sound letters, and we've also received lots of beautiful work back. So there's been a gentle currency. So the wellbeing team of Paulette and Maria have been amazing, because they've been doing so many other things during COVID, and they still managed to, this is a video, but I'm not sure how to work it. Oh, it might just, oh, there you go. I'm only going to show you 30 seconds so we can nip through it. But this is a song co-created by the residents, and they rehearsed using this video during lockdown. And I'll just stop there because it goes on for quite a long time. Let me see if I can get to the next slide. And these are some of the examples of the letters that we've been sending, postcards and images to people we've known for a long time. So that, you know, that there's a real attachment between the team of artists and the residents there. And the artists have also been, for the last 2 years, been working in the palliative care part of the floor 3 at Tower Bridge Care Home as well. So, and again, Paulette has sent us letters back, despite being super busy and up against a huge amount of other tasks. They've been able to communicate back, and that is really important. Actually important for us, the community around Tower Bridge, the local community, and us, Intelligent Arts, actually get given a lot of hope when residents communicate back. With funding, so our previous funding was put on pause, but with funding from United and Saviours, we were able to continue the correspondence with residents during the summer, exploring the theme of the old Trocadero in Elephant Castle and associated themes of stories of cinema, glam, and a good night out. And that includes stories, and we collaborated with the creative producer, Julia Honis, who's a local resident in Southwark and a heritage expert as well as an artist. And so we began to uncover stories of the Trocadero and of Paul Robeson and the civil rights. And these are some of the theatre cards. These were designed for residents with dementia who may not remember us or know us, using the same themes. And they also had aromatherapy in the cards. So, again, receiving letters back. The one on the right is coming back from Tower Bridge. The one on the left is questions and activities connected to the letters. And these, look at these. These are extraordinary stories written during June and July, during lockdown, from residents to us. about their stories of a good night out, remembering those stories, writing them, knowing that we needed those stories as much as them, if you know what I mean, and that we were beginning to look at ways of composing music to those stories and developing them into art. This I love. This was, I'll show you, Pat, who's a resident at Tower Bridge Care Home. This was recorded in June. So Paulette managed to record something despite being super busy. I'll just stop there because I know we've only got 5 minutes. So, but Pat shared her story of the Trocadero, which went viral with Pat's permission. So it went on Facebook, and Pat gave us permission also to share her story at a conference in Finland about what what was happening between arts organisations and care homes during COVID-19. And so Pat's daughter got a lot from that, and has and this has been like a gift back to her as a member of the family. So it has a ripple effect on members of the family when they know. This is another film. I'll show you 30 seconds. But this is a film about from an artist to a resident. It shows you the kind of things that we were doing. So just whizzing through, but it shows you the lightness of humour and how important that element of humour was as a currency to share love, dare I say it, but we can do that in the arts world. We can say words like that. Oh, I've whizzed through, I've missed these are some of the impacts that it had. So I've whizzed through all of that. I don't know if I can go backwards or forwards, but let me see. That this is where my technical abilities disappear into. Oh, there we go. Here we go. Yeah. So residents also received activities packs from us. Residents received our Gnomes from Home Handle with Care activity packages posted out to 300 older people in South East London. So 10 residents got a gnome with pens they could colour the gnome in. Paulette, the wellbeing coordinator, said it was the quality of choice. They took ages to choose which colour, and they actually enjoyed choosing. They were also given a little plant to look after, plus a little postcard. And here we have all the feedback from the wellbeing team and from residents themselves about how much they miss us, how wonderful the cards were, the impact it had on their well-being. And whether it was a choice between, shall I get out of bed today or not? And actually knowing that you were going to receive an activity pack meant that maybe I will get out of bed today. So here we have it brought a spark to people's eyes. So immediate impact on people's well-being. And I'm astonished at the amount of wonderful correspondence back that we got despite everything. There was something about sending packages that was very important. It was the reveal, the opening up of something. It's a very old-fashioned thing, and we've stopped doing that. So in a sense, COVID-19 has lent itself towards technology, and that's something we really need to develop more, even when this pandemic is over, within all care homes. I do a lot of work as a freelancer on quality assurance and report writing in arts and care homes, and there's a lot of potential for technology to the production values to be upped by the arts world, but also it's the old-fashioned ways that need to be upped, like the sending of a package has a huge impact, and many more feedback emerging, and how staff are even looking after the plants. We're now looking for more opportunities. Funding wise, our funding has come to an end, but I'm going to continue doing, once we're allowed in, I'll lead some workshops, and some of our artists for free are going to be sending letters, and this is the last tranche of letters that went out just during October, and that's what's been happening since March.
Thank you, Rebecca. That's a really good snapshot of what you're doing. I know you've done a lot of things across Southwark. That's really good, and it shows that sometimes the old ideas and initiatives are the best. Really, it's actually the social contacts, that actually little things that people can understand. It's not all about technology. Thank you for that, and that's a really good snapshot about showing what an organisation, a local organisation, can do to improve people's health and well-being. And it probably doesn't cost that much, but it's just, for me, the social value and the benefit is, is endless. Really, continue the work you're doing. Has any members got any questions to Rebecca? Anybody? Angeliki Art? If not, thank you for coming and thank you for presenting today. And we definitely want you to come along to another Scrutiny Commission. I hope I'll find it interesting. At this point, I make it 7:38. We're going to have sort of a 5-minute comfort break, and then we come back with Jen. We'll come back and talk about the COVID-19 infection rates. So let's have a break now. You can switch off your cameras and we'll resume at 7:43. Thank you. Hi everyone. Right. Is everybody back? Can we move to item 6, which is the presentation from Jin Lin, Acting Director of Public Health. It was good to just quickly outline what the council is doing in relation to the outbreak prevention control. Jin, are you there?
Yes. Hello.
Hi.
I'm back. Good evening.
I can't see you.
Sorry.
There you are. There you are. I can see you now.
Hi. Hi. I don't think I was going to do a presentation. I've sent
just a quick verbal summary feedback, really, if that's okay.
Yeah. Okay, I've attached, I've shared 2 reports and they're quite detailed. The first report sets the context around the data and in terms of the cases and how the pandemic is affecting the borough, so the most up-to-date data. And then the second report sets out the implementation, and it's an update on the implementation of the Outbreak Prevention Control Plan. So just to very briefly set some context around the data. So currently we have around, in the last week, around 327 cases in Southwark. And the 7-day incidence rate is just over 100. It's 103 per 100,000, and that is actually slightly low. That is lower than the London incidence rate, which is about 152. In terms of across London, just to give you a bit of a sense, all London boroughs, I think apart from one, has an incidence rate of over 100 per 100,000. And Havering has the highest incidence rates of 266 per 100,000. In one of the graphs, you'll notice that nationally, the incidence rates have leveled off, which is great news. It seems to have leveled off. The rates rose very, very steeply from September onwards, and in the last week and a half, 2 weeks, they seem to have leveled off nationally, and there's been actually almost a noticeable slight drop in London and in Southwark. In terms of the pattern and the in terms of who's affected, over the last 14 days, as previously, we're still seeing in terms of the cases that is predominantly the younger, relatively younger age groups, so between 18 and 39-year-olds. It's about 2/3 of the cases seem to be affecting younger people. And it's also mostly still within household transmission and household to household, so sort of, for want of a better term, social visits, I guess. In terms of the implementation of the Outbreak Prevention Control Plan, there are 3 broad strands of work that we cover. There is prevent, there's identify, and there's control. I just wanted to draw your attention to just a few of the highlights in the report. So under prevent, we have now launched, together with our VCS partners, the Community Health Ambassadors Scheme. That is being run through Community Southwark. That's open to obviously all VCS members, but also to members of the public. The aim of the Community Ambassadors Health Scheme is to recruit local members, local community members to be health ambassadors. The thinking is that they will then can provide a sort of conduit of information on whatever the key issues are. So accessing testing, on self-isolation, on whatever the evolving government guidance is, to provide that information through, and also to provide feedback on what some of the issues are in terms of difficulties or barriers in accessing things, or in terms of implementing some of the guidance. The intention is to provide structured support to the community health ambassadors. So there'll be sort of like online forums, there'll be Q&A sessions, And the sort of feedback that we've had previously is that for some communities, certainly I think when before lockdown and after lockdown ends, is that some communities, they actually prefer the old-fashioned hard leaflets, to share the leaflets or to put leaflets through doors rather than always the digital materials. So we'll be providing resourcing and access to some of the leaflets through this particular scheme. Under Prevent, the other key elements to draw your attention to are around enforcement. So there is a weekly deployment plan that's provided through our community enforcement colleagues, our environmental health colleagues, and that is proactive. So they have a deployment plan to areas of the borough or to particular premises that they know are problematic. They also do a responsive, they also take responsive action. So where there are complaints about particular things, then they'll work in partnership with the police to address things. And some of the responsive things that they've looked at are things like unlicensed music events, overcrowded premises, opening beyond, this was before lockdown, opening beyond the allowed times. And they're working with partners to do that. And then the third area around Prevent, it's around communication. So there's a lot of work taking place through our comms colleagues around signage in town centres and high streets, through information that's provided into households, so sort of both letterbox information as well as digital information, and again, working through forums. I'm going to say a little bit about the Identify stream. So the key areas around Identify is testing and contact tracing. So with testing, as you know, about six weeks, about a month and a half ago, there was quite a fall in terms of testing capacity in Southwark. There was almost a 40% reduction in testing capacity. Since then, the capacity's improved. It actually exceeds what we had. And in terms of the testing rates in Southwark, it's far, far higher than it's been. Our MTU in Burgess Park is still there 3 times a week. And you'll also know that we've launched, I think, was it about 3 weeks ago or about a month ago, we launched the Peckham Pulse facility, and that's there 7 days from 8 in the morning to 8 in the evening. And the clear messaging that we want to give out around that is that previously there was almost a lot of negative messaging around the difficulties of accessing testing. That's certainly not the case now. The feedback that we've had is go online, it's easy to book. We've provided the facility behind Peckham Pulse because we know, in terms of car ownership and in terms of people being able to walk there, it's the right sort of place to have it. The MTU in Burgess Park is more for people who drive, I guess. So the messaging we wanted to change is that get tested, it is easy. You don't have to drive all the way to Milton Keynes or even cycle to Lewisham. You can get tested easily in Southwark. The other strand I wanted to just quickly touch base on is around the contact tracing. So as you know, we launched the locally supported contact tracing partnership about a month, 5 weeks ago in Southwark, and we're working with our environmental health colleagues, our housing colleagues, and the call centre on that. And in the first few weeks of starting, we've improved in terms of the cases that we're contacting. So when we started, we were contacting, or rather the national team was contacting around 60-ish% of the cases. And we've now improved to over 80-odd% in terms of contacting the confirmed cases. I just wanted to differentiate between the cases and the contacts. So our responsibility is to contact the cases, not contact the contacts. that's still the national, that's still a national function. But in terms of us contacting the cases, it seems to work, although I think there are lots of caveats that the data as it flows through changes by the day, and that over the last 2 weeks, in fact, we've seen some variation in terms of the quality of the data, which makes it a little bit more difficult to do the case finding, but we are looking into it to see why there is that variation. And then finally, under the identify strand of work around testing and contact tracing, I just wanted to say something very quickly around the rapid tests. So you may probably have seen in the news the various announcements around the availability of these rapid tests. So they're called the lateral flow tests, and they should, if they work wonderfully, be able to provide results in about half an hour. There is an offer for us in Southwark, so we've put in an expression of interest around this, and there's an offer that we are able to access these tests, and our intention is potentially, and it's very, very, very early days, there's very little detail in terms of the support for doing it, and also in terms of the resourcing, but we feel that we should try and pilot this in particular settings. So we were thinking about just to find out first how well they work, and what some of there are a lot of logistical issues around this, but perhaps piloted in around school settings and special schools, possibly around care homes, but we need to talk to our care home colleagues around this on how it can best be used, possibly around perhaps the home care, so peripatetic staff. We'll also think about using it in university settings, so some of the halls of residences, and possibly also to think about some of the, so we know with some businesses, particularly hospitality and other sorts of businesses where they're more front-facing, there may be greater risks involved, but we need to work out with our business partners how best to do that. So there are intentions, there are good intentions, and we've only found out about the availability of these tests very, very recently, and we need to be clear on the logistics and the operating procedures for them. Finally, I wanted to just touch on the last strand, which is around the control. So the control strand is really about being responsive and working with Public Health England, LCRC, around some of the incidents that we get locally. So, for example, if there's a case in schools, then there is there's a toolkit that's used in terms of assessing the implications and to provide the support to schools to do that. And if there, for example, issues at universities, to manage the incident through an incident management team in conjunction with the university and LCRC. I think I'm going to stop there and take questions. So those are the three broad strands in terms of the implementation of the Outbreak Prevention Control Plan.
Thank you, Jin. Your reports are very, very thorough, and it's also they're easy to read as well, the way you've set it out. And thank you for that. Members, any questions so far? No? Councillor Noakes?
Thank you, Chair. Thank you, Jin, for the presentations. Just a couple of quick questions. In regards to the facility at the Beck and Pulse, is that a walk-in facility or is it a drive-in facility? Or both?
It's go on.
Sorry. And in regards to the current figures, there seems to be a possible indication there's a slight downturn, possibly related to the second lockdown. I don't know if that's too early to say or not yet, but the figures don't appear to be, at the moment, going up to the levels that they are in the north. Has there been any further thought, or is there any sort of expectation about whether they're likely to go up to the levels in the north, or is that not considered to be a likely outcome?
Shall I take those two questions?
Yeah,
sure.
Take those two questions.
So with Peckham Pulse, you can drive there, except parking's limited. The intention is it's there as a walk to rather than a walk up. That sometimes when we use the phrase walk up, it's almost as if you don't need to book. So in terms of accessing the testing, we still prefer you to book for the test first. And there's lots of good reasons why, not least we know that when people book when they arrive, that quite often in terms of putting information into your phone, and when you book online when you're walking, you tend to type in a lot of wrong information. And we're looking into that, wondering whether that's what's affecting some of the quality of the information that we're getting back in terms of the test and trace information. But certainly book online and it's walk to, I think you can possibly drive and park at the top of Mellon Road. I'm a little bit uncertain whether they've cordoned off the car parking, but it's mostly a walk to or cycle. There is parking, as you know, behind down Pioneer, is it Jocelyn Street and Pioneer Street, etc. But if you wanted to drive, it's more the Burgess Park one. In terms of the data, it is too early to tell whether or not that dip. So the dip, in fact, started, it's almost noticeably a slight dip about a week and a half, 2 weeks before the actual national lockdown. That nationally it seemed to have plateaued, and partly maybe there was also the change in. So I think communications and media, it's just so important, and I think the message was actually being driven home quite strongly nationally around the impact on hospitals, the impact on for example, around Liverpool, around Manchester, and that may have an impact in terms of how people behaved. And then I think also because of the tier 3 actions up north that might have made people take heed, especially when London moved quite rapidly into tier 2. So it's too early to say. We hope that because there was a little turn about 2 weeks ago, that with a 1 month lockdown, well, it should continue to go down before over the next month and before Christmas.
Councillor Smith, Charlie Smith, go ahead.
Thank you for that. Just to confirm, the 2 testing stations are for people who have had symptoms, not just for people who want to go along and check whether they've got antibodies or not. And the other thing is, I think you can still park in Morrison's for 2 hours, which is just around the back from the Peckham Pulse, just out of information purposes. There we go.
Thank you, Councillor. So is there any other questions for any members? Councillor Williams, go ahead.
Thank you, Chair. Jim, given the fact there are 2 testing centres at Peckham Pulse and Burgess Park, which in my opinion, are a bit too close together, was there any thought given to moving one or both further apart? So more, I mean, I feel like you've got 2 test centres in the middle of the borough, nothing in the south and nothing in the north. Well, am I correct in assuming that? Sorry.
Shall I?
Yeah, go ahead.
Yeah. So thank you for the advice around Morrison's car park, and yes, to confirm, it is for symptomatic people. So the tests are for symptomatic tests. The thinking around the rapid tests, the lateral flow test, is that will be introduced for asymptomatic testing. So that might allow that might reduce the risk in terms of what's for some individuals. That's so, for example, people who are doing front-facing work, etc. In terms of the Peckham Pulse and Burgess Park, we thought long and hard about that we felt that the center of the borough, in some ways, you know, if you live north and south, you could, it's sort of easier, you know, rather than originally the MTU, the Burgess Park MTU was down in Bel Air Park car park, and we had moved it to the center of the borough so that it was more accessible, because we did look in the north of the borough, and it is, I mean, obviously it is difficult getting from the north right down to Bel Air, and it's proving very difficult in terms of finding space in the north of the borough because of the sort of density of the space requirements and the density of the housing and the size of the streets. So we are still on the hunt for something in the north of the borough, and the hunt isn't just for testing. It's also about, we've talked about some of the potential sites for doing the COVID vaccination when that's available, and the intention is to have a good spread of the vaccination sites. So we are looking actively for sites in the north of the borough as well. Yeah, the Peckham Pulse site, in fact, it wasn't that easy to find. I mean, there were some other alternatives, but there were issues with a lot of the sites.
Thank you, Jim.
Councillor Williams, you wanted a supplementary question?
Yeah, I would volunteer up Southwark Park. I'm sure Maria, David, and Sunny, who were all north Southwark. I was going to say northern. We're all North Southwark councillors, and it just strikes me that Southwark Park is going begging. It's quite a big park. It's huge and would be able to accommodate that, and possibly a smaller facility. Canada Water, Dealporter Square, is a massive open plan square and is on a transport hub. So that there are another two options at least.
We'll look into that. Thank you.
Okay, Councillor Linford Hall.
Thank you, Chair. Again, about the facilities in the north, may I suggest, I think Southwark Park, thank you, Bill, is quite a good idea, but there's still will be very difficult, for example, for my husband and I to walk all the way to Southwark Park, or to walk to Peckham, or to walk to Burgess Park. So why not suggest some place like the Geraldine Mary Hansworth Park, which is where the Imperial War Museum is. At the back towards Kennington is plenty of space for you to do that, and that will be in the north of the borough.
Yeah, I think it's good transport links as well, isn't there?
Absolutely. There will be lots of buses in two directions: the Kennington area and then the St. George's Road area.
Yeah, we'll keep looking. I think the Geraldine Harmondsworth Park area was site was site assessed by Deloitte and was found to be not suitable. We also found a site. I can't remember whether it was called Darwin Square, sort of behind the Rockingham estate.
Darwin Court. Darwin Court, I think.
Not Darwin Court by bricklayers. There's a square that's near. Is there an Islamic cultural?
In Chaucer Ward, yeah.
Yes, there's a space there, but somehow again it didn't quite work. It's quite specific in terms of the requirements. So it's like with the Peckham Pulse thing, because they're porter cabins and this and that, and it needs to be, you know, they have some assessment criteria. But we will keep looking, and we're still looking. I mean, we're very keen that testing is easily accessible in the borough, and we're pleased that it's you know, in terms of capacity, there certainly isn't an issue now.
It's very, very important for people who do not drive, for people who cannot walk long distances. It's extremely important.
Yeah, there shouldn't be any problems with the online. If you ordered a home delivery kit as well, the issues around delays there seems to have been resolved.
Okay.
But thank you, because the presentation was very thorough and really, really good. Very interesting. Yeah. Thank you.
Yeah. I just want to ask a quick final question, Jane, about the rapid test. You were saying that it might be in specific settings. Are you limited where you can go, or are you just going to choose schools or colleges? Because when you're saying about hospitality trade, obviously with lockdown too, unfortunately, a lot of those premises are closed, isn't it? So, and with all the, you know, restrictions they've put in place in terms of social distance and whatever, are you going to be able to select schools, and have you got a limited amount of rapid testing, like you've only got 500, or is it once you start it you can roll out as many as possible? And what's the plan for that?
It's like I said, it's very, very early days. It's not to do with the capacity in terms of the testing. It's more to do with the logistics and the operations of the testing. That a lot of it still hasn't been worked out in terms of the actual specifics. So things like, for example, if someone tests positive, how do we actually load up that detail onto the test and trace system? We understand that that if you do test positive, you may have to have a follow-up PCR test as well. There are different. We would need to work out the operating procedures for all the different settings, and they may be slightly different. So from, you know, using them in a school or special school setting will be quite different to using it, for example, in, I don't know, for older children, or rather older people in, for example, care homes or visitors to care homes. I think we also need to work out some of the clinical governance things as well. And as I understand it, that there may be some issues around how effective the test is in, depending on how it's, so obviously in terms of the specificity and sensitivity of the test, the data that we've been given, we still need to look into that some of that might be, you know, when it's done in laboratory or clinical settings, that if you have people self-swabbing, would they still be accurate? So there are lots of things that we need to carefully consider, but if there are views and ideas around the settings that we should prioritize, we're more than happy to consider them.
Okay, thank you for that. Thanks, because I just needed to know a bit more about the rapid testing and how that's going to work out. But if there's no other questions for any of the members, just want to say thank you again, Jen, because you always provide a really good, you know, intensive presentation, but also it's very understandable as well. It's not. Thank you. If I could, did Sam want to? Sam Heppelwhite, did you want to add anything to what Jen has said, Sam? She's still there.
Yeah, I'm still here. Yeah, hi.
Did you want to add anything to what Gina said?
Well, I was asked just to give you an overview of how the NHS was coping. So I've just got a few stats for you. Is that useful?
Okay, if you go ahead and do that. Thank you, Sam.
Okay.
There you go. There you are. I can see you now.
Hi. So obviously these are as of today, so they are only as good as the day that they're available. Obviously things change on a daily basis, but just to give you an idea of where we are, the NHS across South East London is coping well with the demand. We have at the moment 173 patients in our beds in hospital with COVID. And 24% of those patients are in intensive care. So we have seen an increase in the activity of general acute beds with people with COVID over the last week. It's gone up by about 20%, and the same a rise in ITU bed capacity of 11%. Just to give you some idea, we've got 276 intensive care beds in South East London. So that gives you an idea of the capacity we have. Just to also stress that at the moment there has been no impact on the plan around delivering elective, urgent and cancer treatment to South East London residents. obviously that will be continue to be monitored, but that will be a national and a regional decision if that changes. We look at the bed position every day. We look at the 111 activity every day. That is quite stable at the moment. Haven't seen any real peaks. It's about in line with where it was in August. We're not seeing a massive increase in the presentations at the A&E department, but what we are seeing is an increase in mental health activity, which you won't be surprised to hear. What is different is that there are a high number of previously unknown or existing service users. So we are seeing presentations from people who haven't necessarily used those services before. And obviously that's adding to the complexity around their admission and treatment because they won't have a treatment plan already established. We also monitor staff absences across trusts due to illness and COVID. So I'm very happy to provide the committee with a sample of the information that we've got here, but just to say it's obviously out of date the next day, but it gives you an idea of where we are.
Thank you, Sam. That's a quick snapshot. Is there any questions from any members to Sam? Councillor Noakes?
Thank you, Chair. Thank you, Sam. Just a couple of questions. In regards to A&E presentations, I mean, to what extent is that back to normal levels pre-COVID? I don't know if you can give a percentage or any sort of sense of where.
It's roughly back to where it was pre-COVID, A&E presentations, yeah. Okay,
that's positive. And in regards to the intensive care beds and ventilators and things, I mean, obviously in the first wave, there was a big sort of concern about whether we'd have enough ventilators and enough beds. I mean, has capacity been increased either locally or nationally as a result of the 6 months that have passed since the initial outbreak?
So there was an awful lot of demand and capacity work through both wave 1 and in between wave 1 and wave 2. So we have increased the capacity for intensive care across South East London. We obviously also have, which hasn't yet been mobilised, remobilised the Nightingale Hospital, where there was a huge amount of equipment and beds available there. So we have not used our intensive care capacity fully, obviously during wave 2, but there is scope to flex that should it be required.
And sorry, just that.
Yeah,
just one final thing. And in regards to the increase in mental health, how is that sort of that increase being showing? Is it showing in the number of presentations? I mean, do you have figures around that, or what's?
I don't have with me, but I can certainly get them for you. But it is mainly being presented in a crisis rather than. So if you talk to the GPs, they're seeing a lot of people at the moment, not necessarily with COVID, but with sort of underlying anxiety and just generally unhappy people at the moment. That's how it's playing out in primary care. And then in secondary care, there's a lot of presentations at emergency departments. And also there is a lot of presentations through mental health services. But as I say, some of those people have never been seen before. So it's particularly worrying about that group of people who haven't necessarily presented in that way and therefore don't have sort of treatment plans.
Okay.
Thanks for that, Sam. And I mean, I'm seeing that in my work as a trade union. I think a lot of people, there is a lot of workplace stress, especially people working from home as well, or trying to work from home. And there's a lot of demand from employers who are changing the rules and saying they're demanding to change the nature of how they're working. So obviously that's been shown in increase in mental health, because it starts with work-related stress and then it increases to other things where they're saying to their GP they can't cope. So I think we need to keep that in mind as well. There's a lot of people who are struggling at home to actually work from home, but also their mental health is deteriorating at the same time. Sam, are you still there? Okay, she's gone off the camera. Is there any other questions? Oh, right, okay, sorry. I think that's a concern. I think that probably makes up that first group of people who are not formally in the system. There's people who are literally struggling at home, working from home and thinking, okay, let me contact my GP. Then the GP is thinking, okay, I need to give you some, you know, there's only so much talking therapies, but also they're accessing the mental health system far more than they would do before. So I think
and obviously some of those people are accessing their work occupational health services as well, which we wouldn't necessarily have sight of. So I think you're right. Yeah.
And if they're not doing that, the first port of call is calling their GP and saying, I'm struggling, and the GP is saying, let me refer you. Is there any other questions for Sam or Jin? Okay, thank you both for that. Again, really good presentations, a lot of the information, whatever. Can I introduce Jackie Parrott, the Officer for GSST. Hi, Jackie, and your colleague is Robert Craig to talk about the proposed merger between Royal Brompton Hospital and Guy's and St Thomas. Thank you, Jackie.
Good evening, Councillor Lisa and other members. Just conscious of time, can I take the paper as read, and do you just want to go straight to questions, or do you want me to give any introduction? I'm very happy with either, but we'll be guided by you.
No, I assume that members have taken the time to actually read the paper, because it's only nine pages. If there's any questions, I've got a couple of questions, but let me take questions for members first. Any members got any questions? Councillor Noakes, go ahead.
Thank you, Chair. I suppose my question is, I seek, I suppose, some reassurance that if this merger was to go ahead, that it wouldn't have a sort of a negative impact on Guy's and St Thomas's performance and financial position. I suppose I'm thinking back to when King's took over the PRU and the A&E, and the sort of what seemed to be a knock-on effect in regards to performance and the financial situation of King's. I mean, obviously, I know that this is being considered as part of the process of looking at the options, but can you give me any sort of additional reassurances about why that's not, neither of those financial or performance concerns are seen as a block to moving forward towards a merger?
Yes, thank you. And as I said, I've got Robert Craig, who's my colleague from Royal Brompton and Harefield, with me. So very different scenarios. The King's and PRU, and sorry, I should have introduced myself, Chief Strategy Officer for Guy's and St Thomas's and King's College Hospital. That was a breakup. That was the Trust Special Administrator process. Both Guy's and St Thomas's and Royal Brompton Harefield are rated good in their CQC. Both are successful and thriving organisations with excellent finances. Royal Brompton Harefield, and Robert can say more, is renowned internationally for the quality of its service and research that it provides. So this is two organisations choosing to come together, as opposed to being part of a breakup of an organisation with South London Healthcare Trust that was demonstrably failing, and choosing to come together as two strong organisations. We're using the legal vehicle of merger because that's the vehicle open to us, but it's not one strong organisation taking over a failing organisation. Absolutely not. Quite the reverse. It's two strong, thriving, very solid organisations choosing to come together to be better than the sum of their parts. Robert, is there anything you'd want to add?
I think you're muted.
Oh. Sorry about that. I think Jackie has said as much as I could about Brompton and Harefield, but only to echo that I think these are very different circumstances. These are two organisations, as Jackie says, who are excited by the opportunities that bringing our services together and creating one organisation presents, rather than one trying to rescue the other.
Okay, thank you for that. I've got a couple of questions, and then I'll come to Councillor Maria Lingford. My couple of questions, reading through the reports, is I suppose it's easier said than done. Can you, in a snapshot, tell us what's the benefits for Southwark residents? Because obviously we're all covering different parts of Southwark. So we need to see what the benefits are. Is it in terms of service delivery? Because I've read through benefits, you said 2.0, you enhance healthcare, etc., etc. And my second question is the concern that at 3.7, where you said about after 6 to 12 months, there's going to be strategic review to do strategic alignment. In a cynical way, I'm thinking, does that mean efficiency savings? Does that mean job losses? Does that mean streamlining of services? What does that actually mean in plain English? Because that's what my concern is. After 6 to 12 months, all of a sudden there'll be realignment, which basically will mean some people will be 2P'd and there may be efficiency savings and there'll be significant staff cuts. That's my two questions. Then I'll come to Councillor Maria Lingford. Paul.
Okay, thank you. So just to be clear, and it is a bit complicated, what we are currently pursuing is a merger of the two organisations. In terms of any service changes, that would have to go through all the usual consultation to make moves of services from site. So in itself, the merger of the two organisations does not necessarily and will not be resulting in service change. That would come through appropriate consultation and involvement with relevant stakeholders. That said, we do believe that there are huge benefits of the two organisations coming together and in time working, of course, as part of King's Health Partners and realising the wider vision along with King's College Hospital and King's College London. But that is not of itself happening through the merger. In terms of that paragraph, I think what we're really saying is that the plan from day one is that the Royal Brompton and Harefield will move in as a care group under Guy's and St Thomas's, and then we will look to see how we can integrate the services that Royal Brompton and Harefield provide with the equivalent services within Guy's and St Thomas's. So just to explain, Royal Brompton and Harefield focuses on cardiovascular and respiratory services for adults and children, and that's a small percentage of the work that Guy's and St Thomas's undertakes because we have a much wider portfolio of services. So that's really what it is meaning, and we have given a commitment. We have a TUPE process in train at the moment. Robert might want to say more about that. And we have sought to reassure people that other than potentially at the very senior posts, we are not looking to make redundancies, Robert, and we've given that assurance to staff.
Perhaps I can just add a couple of things, because Councillor Lisa, I think you wouldn't be surprised to hear that some of our staff have asked the same question, to say, well, we understand the TUPE process, but you know, 6 months down the line, there's a strategic review, and then, you know, we all lose our jobs, do we? And, you know, clearly one can understand why there's an anxiety about that, but we've been able to reassure people to say, no, the review process is as Jackie describes it. It's really an intention to say, once we've moved into a new organisation, how do we sit down and start planning the future of our services together? And we are convinced that we will need as many people as we currently have to continue to provide the services that we're going to continue to run in the future. And actually, if anything, coming together with a large organisation like Guy's and St Thomas's, I think will strengthen the resilience of both trusts as they are at the moment, one trust in the future, if the merger goes ahead. So that where, for example, we're carrying vacancies which are not always easy to fill, and Guy's and St Thomas's are carrying vacancies that aren't always easy to fill, then actually we're better able to support a service across the different sites. So we really don't see this as I mean, this is not about a financial transaction, and I think it goes back to the point Jackie made at the beginning, that this is not being done because there's a financial problem in either organisation, and therefore there's no pressure to say we must go in and save money as a result of this. That's not the plan.
Okay, we'll see. Councillor Maria Lingford Hall, thank you. You had a question?
Thank you, Chair.
Yeah.
some of the answers have reassured me, but still, there are two different hospitals, two strong hospitals. And my biggest concern at the moment, and I want some reassurance, is what will happen to the cancer center in Guy's. Will there be any changes? What will happen?
No plans to make any changes to the cancer centre at Guy's at all. So Royal Brompton and Harefield provide a lot of thoracic surgery and work with the Royal Marsden, and they're in discussions around the future of that service. Particularly the thoracic services and those cancer services the plan is that they remain as they are at the moment on the Guy's site. So there is that wouldn't arise out of this merger anyway. That would come after consultation through any plans to change services, but we are not planning to make changes to the Guy's Cancer Centre or the services provided from that as a result of coming together with Royal Brompton and Harefield.
Thank you, because the Royal Brompton is obviously working in conjunction a lot with the Royal Marsden, and the Royal Marsden is also a very strong hospital for cancer, and they specialize in cancer, and there are always a rivalry between the cancer center in Guy's and the Royal Marsden. That was my preoccupation, my biggest preoccupation, because of that. That they will be taking a lot more towards although it's a very specialist center, the cancer center in Guy's, but they will be taking more of the service towards the Royal Marsden.
No, that is not at all the plan, and we have not had any discussions. And again, that would not happen as a result of merger, but no, we are not even discussing that, and that's certainly not the intention.
I very much hope so. Thank you.
Thank you. Councillor Williams, did you have your hand up? You wanted to ask a question?
I did, Chair. Thank you very much. And it goes back to your introductory questions around merger, strategic review, and possible redundancies, job losses. Cards on table. I am a former employee of GSTT, so this news is not new to me. However, having been through two mergers in a previous role in the voluntary sector, without sounding too negative, there is always a business case for a merger. It's never purely ever bringing two brands together to create a super brand. It never is. And I think people are naive to believe that. And GSTT prides itself on being a major, large local employer. So it's not just the patients, Southwark patients that are my concern. It's also your staff that are our constituents. And you're going to have a 6-month review, strategic review. Inevitably, and I firmly believe this, inevitably there will be redundancies, whether they're voluntary redundancies because people don't want to be chupied over, they don't want to be redeployed, but there will be job losses. And I just think it's a bit disingenuous to say at this stage there won't be. There may not be at point of merger, but there sure will be after the strategic review.
I think just something that will perhaps illustrate why Robert was saying that we actually believe that we'll continue with the staff we've got. Whilst it wouldn't happen through merger, as I keep saying, it would need to be consulted upon. We are not seeking to move the services from Royal Brompton and Harefield with any immediacy. We would need to create new facilities, potentially NHS England will be consulting on the future of children's congenital heart disease services, which is where this whole partnership came about through the review of those services. But still, we need to create more facilities in order to be able to physically transfer those services, should that be approved through future consultation and engagement. So as Robert says, we will be running all the facilities that Royal Brompton and Harefield are currently in their current locations with the staff needed to do that. We are not pooling our staff yet, other than, as Robert said, where we've got particularly small groups, we may be able to move people across site or pool their expertise. So it's very difficult to know how we would continue to run the services that Guy's and St Thomas's is already providing in our current locations, and those within Royal Brompton and Harefield with significantly reduced staff. And all we can do is seek to reassure you that that is not at all the conversation that we'll be having. I understand where your question is coming from, but given that we'll be running these services for some years, it's difficult to know how we would run the services across that distributed location and maintain the quality that we currently have, seek to not only maintain but improve by significantly reducing the workforce.
Thank you for the honest answer, and I think it's one to watch.
Yeah, may not be for this scrutiny commission, it could be the next one in 3-4 years time or whatever, but I think it's important that we ask that, because our concern is if we don't ask it now I've done enough strategic reviews, like Bill knows, with in my day job, to know that there may just be 1 or 2 2Ps, but then in 3-4 years time the landscape may not look as different, the same as it is now, and unfortunately with funding cuts other difficult decision may be made. Is there any other questions from any other members? Councillor Smith, go ahead.
Thank you, Chair. The Brompton Hospital is an old Victorian building, and it's been sort of expanded and built upon over the years. Long term, how do you see that facility carrying on? Because it's probably bursting at the seams now. Would you maybe envisage selling up that site, which is very prime development land, and buying somewhere just on the fringes to make a nice large new facility?
So these are all things that we will be considering, and once we've consulted and that process has gone through in terms of particularly the children's, we'll then consider long-term where adults will continue. The intention is that certainly the services provided at Harefield will continue as far as into the future as we can imagine. We are thoughtful about, as you say, with the older estate, and have been having conversations around what could be potentially built on the St Thomas's site to potentially accommodate. But again, that's not as a product of merger, that would be as a result of any consultation down the line. But clearly coming together as one organisation will make those potential changes easier in the future. But again, not anytime soon. We do not have a building sitting at St Thomas's ready to go. I can assure you. Robert, is there anything else you'd want to add to that?
Thank you. Yeah.
I think I'd only add that you wouldn't be surprised to hear that we have relatively frequent conversations with councillors in Kensington and Chelsea about the estate and its future, and one of their areas of interest at the moment over the merger is what will happen to the estate in due course. And obviously in the short to medium term, certainly as far as we can see the foreseeable future, we're going to continue to use it as a hospital facility. Yeah. Much further into the future, we'll have to see, but we'll obviously be engaging with them about the use of that estate if we decided we didn't need it for hospital purposes at that point.
I know, can I just add something from someone who worked there for a number of years? It's riddled with mice, but that's another story.
Councillor Smith.
Most hospitals are, Charlie.
Is there any other questions for any other members? Okay, if not, thank you, Jackie and Robert.
Thank you very much.
Very much.
Thank you.
Probably didn't give you too much of a hard time. Thank you.
Chair, I've been raising my hand.
Sorry, Councillor Lammy, do you want to ask some questions to Jackie or Robert, please?
Yes. Yeah, just to build on the points raised by Bill and everybody else. Just one question. Is there going to be a community impact assessment either before or after the merger has taken place?
Andrew might need to help me out here. I don't think as a result of merger, because we are not looking to change any services. Any equality or other impact assessments would take place if we were looking to change where and how services were provided. Andrea, who is our colleague and known to some of you, leads on patient public engagement for the Trust and for this partnership, may want to say more. Andrea.
Thanks, Jackie. I mean, so, no, Jackie's obviously absolutely correct that given that merger's not determining any service changes, equality impact assessment would not be required, and indeed there's no requirement to consult on the merger itself. So, and of course, any proposals for the future and service changes would have to be equality impact assessed in and around the NHS England-led public consultation process. So it's certainly, Councillor Lammy, something that we would be mindful of, but it was something that NHS England would have to be accountable for overseeing as part of that consultation process.
So you're telling me there's not going to be community impact assessment when the committee had two choices of two services in the past. All of a sudden, they're now going to merge together to become one. So instead of having two independent, they're now going to have one. And you're telling me there's not going to be impact on the community and the service users. I think I will suggest you need to do more work on that. Definitely there's going to be, I don't know how much, how far, the intents of it, but definitely there is. I need to consult on that.
So Councillor Lammy, I think it's important to clarify the difference between the merger transaction and the vision of the partnership for the future of heart and lung care, which is a separate process and a separate programme. The merger is ultimately bringing together the two organisations, but as part of doing that, we're not making any changes to the services. Therefore, you can't equality impact assess the legal transaction of bringing those two organisations together. It's not making any material changes to services. The services are remaining as they are for the present, and certainly for some considerable time in the future, as Jackie and Robert have outlined this evening.
Well, I think even if it's not going to be much, it's something you need to sell to the public, to the stakeholders, to convince why you think it's a reasonable step to take. I'm not doubting what you're saying. What I'm saying is you need to convince, and therefore you need to have a business case to prove merger is a reasonable way to go about it and why it is a sensible way to go. That's what I'm saying.
Can I just interject here, Andrea? Councillor Lambert, I hear your reluctance and also your concern about wanting the community engagement, but I think this is slightly different merger to the ones we've had previously, the Kings and the PRU. This is more, from what Jackie and Robert said in the papers, it's more about two trusts coming together, do completely different things to be a stronger corporate trust and business in the middle, rather than our usual traditional mergers, which is let's look at the services from one and the other, and they're similar services and we're going to have to reshape them. It's just that strategic review and alignment of after 6 to 12 months, and no services, from what Jackie and Robert said, is going to change significantly over the next 2-3 years. So the impact on the public, I assume, is not going to be that different. It's not like they're moving it from one site to another. Eventually, over over 2-3 years, they may move sites. And I think at that point, there may be an impact on how people are going to access services. But I assumed from what you said, Jackie, that nothing's going to change significantly over the next 2 to 3 years, especially not in service delivery or whatever. It's just the merging of the two strong trusts to share expertise.
Exactly.
I'm not selling it for you, but that's what I've read and that's what I've assumed that we're trying to do.
That's a brilliant.
We have read
summary.
the papers as well. With due respect, Chair, I've read the papers as well, and I think it's for them to make case for that. It's not for us. Ours is to ask the questions and for them to provide the answers. And I didn't see answers there, and that was the premise of the question. So I rest my case.
I think just to reinforce the point that we are not just by bringing in effect the sort of governance and management of those services in with Guy's and St Thomas's, that of itself is not making any service changes. To your point, Councillor Lisa, we potentially the first services that may move might be paediatrics, but that would be subject to full consultation. Then, of course, the assessment that Councillor Lammy is referring to, and then for other services that potentially is many years away at the moment. So yeah.
So you're confirming that when services, if services do change, or there's a how can I put this, rejigging of services, obviously down the line in the next 2-3 years, then you'd have to do community engagement, then you'd have to do community consultation, because that has a direct impact on patients. But at the moment, it's not going to have any direct impact.
That's exactly
just
right.
Put that in plain English. Is that what's going to happen?
That's right. And as Andrew said, that would be led by NHS England. They have the statutory responsibility to undertake that consultation. So that's right. Yes. So what you're saying to us, I'm trying to put it on paper and pin you down, it's 10th of November 2020, that there's no services are going to change in terms of their delivery for at least the next 2 years? Well, I mean, I'm
reading your report, but you can't say that. But let's agree to disagree. Let's just see from what your report says. It doesn't show there's going to be any significant change in services for the next year or so. But hang on, let's keep an eye on it. And if there is any significant service delivery, that's why I was saying what are the benefits to, so that residents, are they going to see any change in services? If they're not going to see any changes in services, that's fine. But if there is going to be any changes in service, I think we need to know as councillors, but also we need to be aware of that. So then to make sure that there is a quality impact assessment, there's also community impact assessment as well, to make sure that parts of our borough are not being left high and dry because they can't access the service because of this merger. Because I see the merger starting the 1st of February 2021, which is only, 3 months away? It'd be good to see what that working document is like. And then I don't know if the commission, if it's here in 12 months time or 15 months time, to have a look and see what's happened in the first 6 to 12 months of the merger, and if there's any lessons learned. That's just a recommendation I'd say to us.
So just to be clear, through merger, there will be no service changes, just really an administrative and a governance change. There would always be consultation involvement and the appropriate impact assessments for any service change, just to be really clear.
Okay, so there might be a name change February 2021, but there's not going to be no service change. That's what you're saying?
Yes.
Okay, thank you. Thanks for clarifying that.
Thank you.
Is there any other questions from any other members before we move on? Thank you again, Jackie and Robert.
Thank you. Thank you very much.
Come back again. Thank you.
Thank you.
If we can go ahead to item 7, is about healthy inequalities. I don't know if anyone's had access to have a look at the letter that we sent to the cabinet member, Jasmine Ali, which set out the BME and the sort of 5 pages about mental health and the BME communities, but also attached to the reports for this meeting was the report from Baroness Doreen Lawrence, because I know at the end of the last municipal year, we were talking about the disproportionate impact of COVID-19 on BME communities. I don't know if there's anybody's got any comments or questions. I've just got some suggestions for recommendations about what the council I think we should do. Has anyone got any questions at this point? No? I mean, I've read the report by Baroness Doreen Lawrence, and I think there's a number of key, I'd say, recommendations that I think that maybe we should put back to the council. I don't know, Julie, if maybe we could put back to Kieran Williams or put back to the cabinet member. The new cabinet member would be Councillor Helen Dennis. Things like, because there's suggestions like looking at the public equality impact assessment, asking the government to do that. I think we as a council should ensure that we're doing that to ensure that BME residents are able to access the support they need for COVID-19, to look at the health inequalities. I know that Kieran came to OSC last night and he was talking about the health inequalities, but I think as a scrutiny commission, we should reinforce that and say, have a look at the health inequalities of the BME community. What does that look like? What is the council going to do? Have they got an action plan for that? Because it's easy for people to say, yes, we're going to look at that. But I think I'd suggest as chair of the Scrutiny Commission to ask Kieran and his team about what does that timetable look like for the BME community, and also other protected characteristics, the LGBTQ communities as well. And I think that I'd make a recommendation as a chair, I don't know if I can, that the council looks at the report recommendations, because there's some things you can actually drill down and do locally. And even look at things like looking at the no recourse for public funds. How does that impact on certain communities that we're dealing with? Yeah. So that's just my recommendations of what I've seen of the Baroness. Obviously not all the recommendations, but there's key ones that I think as a council we should look at, recommend to Kieran and his leadership team and say, what is the council going to do about that? Councillor Linford Hall, yeah?
Yes, I think that you did absolutely brilliant, the recommendations that you put together, because I think that it is very, very important that the council look into what is going to happen with especially the children that had come out from domestic violence households, because at the moment they are really, really struggling, they are really, really suffering. And I think also a point that you made about the no recourse of public funds, a lot of people don't have recourse of public funds. So how are they going to deal with it to treat those children that are suffering from mental issues?
Yeah.
So
thank you.
That just to add to what you have said.
Okay.
Thank you.
Is there any other suggestions or recommendations or thoughts from any other members on the commission? Okay. Last but not least, item number 8, the work programme. Have we got any other items for the work programme? Because we did say we were going to look at the mental health of Councillor Noakes, got your hand up.
Thank you, Chair. As you're aware, Chair, we were approached by the campaign group to keep the NHS public.
Yeah, yeah.
And
unfortunately, I couldn't guess that means.
No, indeed. But obviously they have, I think, concerns about obviously the change from Southwark CCG and the merger into the 6 South East London CCG, and also in regards to some of the things like the NHS improvement report, the journey to a new health and care system. And I'm just sort of, it was quite a useful conversation I found, in the sense that I think it reminded me, and perhaps it might be useful for some of the other new members, about the changes that are going on in the NHS at the moment in regards to structures and decision making. So now we've got, as I say, the six borough CCG, and then we've got the borough-based body that makes sort of more localized commissioning decisions. And I just thought it might be useful to perhaps at our next meeting, if the agenda's not full, but to perhaps to ask for a report and maybe to invite some of the representatives of the CCG just to come and talk, to give us an update really on the current direction of the NHS, and just how we as a scrutiny committee can have, you know, so that we understand the structures and how decisions are made, and how commissioning is being made, at what level it's made at a six borough, and at what level it's made at a local borough. Because I feel a bit like we're not completely up to date with the current structures and decision-making processes. And I would find that useful, and depending on what comes out of that, we may or may not want to pursue it further, but I think certainly something on our agenda for the next meeting, if that's possible, would be helpful, I think.
Definitely. Unfortunately, I can go to that meeting. Definitely. I think that's a really good point, because I think that's like a mainstream issue all the way through our health thing. And I think now is it's like this, we've got another merger, and I think that's important we put that on the agenda for the next meeting. I think that's a really good idea. Invite the NHS and the CCG, especially Southwark, but also I think, Julie, if we can invite that campaign group, definitely keeping the NHS public, because there's a lot of work and research they've done from Dr. Tony Sullivan, etc., to hear what they have to say, because I mean they've got a lot of information in terms of all the different mergers and whatever, and I think it'd be really good to have that as a key agenda item at the next meeting, because then what will come out of that is we'll hear the NHS, what they have to say. I mean, and I welcome all your comments today with to this proposed merger with Royal Brompton and Harefield, because I think we're all getting quite cynical when we're told nothing's going to change or whatever, but we know inevitably it will change. So I think it would be good the next meeting, June, if we can invite the Southern CCG, also invite the Keeping the NHS Public, I think Steve Lancashire and his team, but for them to do a presentation, but also because there are a lot of community people, to give their community feedback about what they see as a community, what are the key issues for them, and also maybe outline, I think, what they've said to you, David, about what they would like to see, what support they need from the council, and what they feel we should be doing as a Scrutiny Commission, because I think we have to hold the NHS to account, because if we don't do it now, you know, it's just going to be in a couple of years' time, there won't be, you know, everything will just be done and dusted, isn't it? I mean, what does other council members think? I think that's a really good, significant area of work that we need to tackle.
I agree with Councillor Noakes, Chair.
Thank you.
I absolutely agree with Councillor Noakes, Chair.
Thank you. Charlie and Sunny, yeah? Thank you. Can we put that in the agenda item for, as part of our work programme, but definitely for the next meeting, Julie? Because that could be the key part of our meeting, because most of the care home stuff we've done now, and I think maybe that's a significant way, and then we could probably try and drill down what is the NHS doing, but also I think the key thing is about how they're engaging with the communities, because the problem we've had at the joint OSC with Lambeth and Southwark and the 6-borough one is they've said they do community engagement events, but in reality they tend not to happen. So, and I think it's important about holding their feet to the fire now to say, are you actually engaging with the communities? If you're not, why not? Okay, is there any other suggestions for the work programme? Because that could probably take the next 2-3 meetings, but yeah, any other suggestions? Yeah, and I think the other suggestion, we said we'll interview the cabinet leads for children and adult social care. That will be Councillor Helen Dennis, so she'll give a new spin on that. Councillor Smith?
I don't know what you think about this. Over the last 20, 25 years, smoking has decreased. Smoking of tobacco, that is decreased. And we've had legislation that means you can't smoke in the workplace or anywhere else, which is a terrific thing. And it's probably brought cancer, lung cancer deaths and other bronchial deaths down. But there's been a rise in this so-called vaping. You see people in the street sucking on these different little implements, blowing out this smoke, which you're led to believe is harmless, though I think it is nicotine-based somewhere. And I think it's probably early days to find out or know whether this vaping, as it's called, which is a horrible word, but anyway, how dangerous, potentially dangerous it might be, because it gives the impression you can buy, you know, sweet smelling or tasting vanilla vapes and all this sort of, it's a bit like alco pops, you know, to make it sound pleasant and agreeable. But I just wonder, I don't know if people think it's an important issue or not, but it's just something I had in the back of my mind that we could maybe look at. I don't know, maybe in the future, who knows?
I mean, is that something we could pick up in a sort of briefing paper from one of the NHS providers or whatever, Julie? Because is that part of the whole, not smoking cessation, because sometimes some organisation might say smoking cessation, you know, what's the alternative? Vaping is not as bad as smoking. I don't know. I mean, then have a briefing paper and then we can discuss that at a meeting. What do you think?
Yeah, you could certainly. I mean, I know that Jim previously has given some evidence on the safety of vaping. You can also look around for other research on it as well. So there'll be a couple of different avenues that you could pursue on that. But you could certainly get a briefing from Jim or from NHS. But
yeah, I think Jim's been really good because his is very thorough, but also you have that sense of confidence that even if you give him difficult questions, he'll come back and say, right, let me find the information. But research thoroughly, maybe you can put that in the agenda.
Sure.
Thank you,
I think would be the first point of call, definitely.
Yeah. Is there any other suggestions from any members? Thank you. No? Okay, thank you for that. So the next meeting is going to be mid-January. For most of you, I think I'll see you at the Council Assembly on the 25th of November. But for everybody else, I'll wish you early happy Christmas and I'll see you in the new year. Okay, thank you.
Thank you, Councillor. Thank you, Chair. Bye-bye.
Thank you.
Is the next meeting not in December?
The next meeting not in December because you're trying to fit a date now, and it's now what, 10th of November. I mean, if we were going to do December, we'd have to do it literally about the first or second week, because I think by then I don't know, it depends on lockdowns, but by then there's people switch off by the middle of December and actually, you know, go and deal with families and whatever. So we're thinking let's have it in the middle of January instead. I mean, I don't know, Julie, did you?
Yeah, that was the plan, because I think the original date was moved to November. So the idea was to sort of pace them better. So yes, we did provisionally sketch in that the next date would be mid-January.
Okay, thank you.
Okay then.